Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. It's like, how many videos can Dr. Hauser do on the trigeminal nerve? And trigeminal neuralgia is easy to diagnose in that somebody has horrible lancinating electricity type pain on one side of their face. I just do these videos because the trigeminal nerve can be involved in a lot of different weird or unusual or common problems in the head, in the face. Give you an example. Say somebody had horrible flushing or heat sensation in the face, or one side of the face is hot and the other side's cold, or nobody can seem to figure out why a person has horrible migraine headaches or cluster headaches. In other words, the person takes medications, that's fine, but headache isn't a medication deficiency, right? Especially if the person has clicking of the neck, cracking of the neck. Chiropractic care helps somewhat, but it doesn't resolve it. Or a person can't hold an adjustment, right? It's likely it's a neck problem. And the pathophysiology by which neck problems cause symptoms in the head, the face, the eye, the ear, even the mouth, it can be through the trigeminal nerve. So that's kind of why I want to make these videos, because again, it goes on and on and on. Somebody could have a gritty sensation in their eye, right? They go to the ophthalmologist. The ophthalmologist says, oh, you're not making enough tears. You have dry eye disease. Yeah, but what's causing the dry eye disease? I know I could take medications, I could do eye drops, but if you're like me, I want to get at the root cause of the problem. Because almost all medical problems, if you don't get at the root cause of the problem, it's going to progress, right? That's just kind of common sense. Your kid has a messy room, right? If you don't have the child clean the room, what's going to happen to the room? Yeah, it's going to get messier and messier. Then you're going to get insects in the room. Then the insects and all that stuff go all over your house. Now you have a major problem. Like you just can't, you got to get at the root cause of problems. And a lot of weird things that go on in the brain, in the eye, in the ear, the mouth, it's related to the trigeminal nerve. The trigeminal nerve does sensation. It's well known that it does sensation over the head, the face, the ear. So this part, and this part is a trigeminal nerve. Then the rest of these are the cervical nerves. But what's not commonly known is the cervical nerves have a connection to the trigeminal nerve, and that's kind of the main point of this talk. It's called the trigeminal cervical nucleus. You guys have probably seen this before. What's on here, what isn't on here is the eye, the sinuses, right? Somebody might have a weird sensation in the eye, or they have sinus pressure and you can't keep taking antibiotics, right? But you have sinus pain. Well, the sinuses are innervated by the trigeminal nerve. So you could have a problem with your trigeminal nerve causing quote unquote sinusitis, right? So if the trigeminal nerve problem is from the neck, taking antibiotics, what's that going to do with it? Plus all the side effects of taking antibiotics. But all these things can be because of trigeminal nerve dysfunction. The trigeminal nerve originates from the brainstem, and it is involved with sensation, touch, pain, and temperature for all these things, right? Somebody feels certain teeth are hot or painful, and the dentist says there's not a problem. You don't have a dental problem. Well, you should think of, yeah, I probably have a trigeminal nerve problem. I've had people where they have pain in their lips, right, or one side of the lip. Sinus pain, cornea, right? The cornea is the outer part of the eye. The outer part of the eye. Well, if you have itchy eye, gritty eye, dry eye, it could be related to the trigeminal nerve. And again, tongue pain, burning mouth pain, eyeball pain, eye pain, facial pain can all be because of the trigeminal nerve. So when a person has upper cervical ligamentous instability, it can block the cerebral spinal fluid. The cerebral spinal fluid then can accumulate around the trigeminal nerve and give you trigeminal nerve problems. And ligamentous cervical instability can block the jugular vein. If it blocks the jugular vein, again, because the brain can't drain, that means the cerebral spinal fluid or the fluid around the brain can't drain. Where was the fluid going to go? It's like a river that's all dammed up, right? It's going to just flood all the houses by the river. So when the fluid in the brain, 70% is in the venous system. So when the venous system is blocked here in the upper cervical region, all the other fluid has to go somewhere. So one of the places it goes is around the trigeminal nerve. And when it goes around the trigeminal nerve, you can get heightened sensation or painful sensation, or you can get nummy feeling. So anything that is involved with the trigeminal nerve. The trigeminal nerve is involved with circulation. So if you get dilation of blood vessels, that's where you're going to get where the face is red. The face is red, the face is hot. If you get too much dilation of blood vessels inside the brain, that's what causes horrible, horrible headaches, and the person has to lay down for an hour, 2 hours, a day, 2 days. That can all be from the trigeminal nerve. And again, if the sensation is affected to the sinuses, to the ear, to the mouth, to the eye, you can get severe pain in those regions. So if you have severe ear pain, severe eye pain, severe tongue pain, severe mouth pain, severe facial pain, it can all be from the trigeminal nerve. And see right here, the trigeminal nerve interacts with the upper cervical nerves. So the upper cervical nerves, that's what innervates the muscles in the upper cervical region. So if somebody has ligamentous cervical instability, what happens is the muscles clamp down. So that's a sign, if you have any of these symptoms that I've been talking about, if you have clicking, popping, grinding neck pain, or you have severe tension in your upper neck, it's likely that this is the pathophysiology being involved with it, that you have ligamentous damage here. It's irritating these nerves that interact with the trigeminal nerve and then give you, facial pain, sinus pain, gritty eye, dry eye, ear pain. The way modern medicine treats trigeminal neuralgia often is with blocks. They might block the trigeminal nerve, and eventually they might do some type of treatment that limits the nerve impulses of the trigeminal nerve, including surgery or different kinds of invasive things. Obviously, if the problem is from the neck, I think the treatment should be directed at the neck. So the way we document that the problem is from the neck is by doing digital motion x-ray, which is basically a movie camera picture of the cervical vertebrae while a person moves. And then what we normally find with trigeminal neuralgia type conditions is that there's excessive movement of the vertebrae. And that's because of ligament damage. So when we do prolotherapy of the ligaments tighten. That will limit the motion of the vertebrae, stabilizing the spine, and thus less irritation or no irritation of the trigeminal nerve, and those symptoms go away. And this just kind of shows you that all the upper cervical nerves, they're kind of connected. There's lots of different substances that are released when there's a trigeminal neuralgia, and these substances, substance P and other substances, they cause severe pain. So if you have some kind of horrible pain, the eye, the ear, the face, headache, it may be related to an irritation of the trigeminal cervical nucleus from upper cervical instability. So upper cervical instability causes the atlas to go forward. These muscles clamp down, the suboccipital muscles, to try to limit the top vertebrae from going forward. if the top vertebrae goes forward, that's what's going to cause the obstruction of the jugular vein, and it's going to irritate that area, stimulating the trigeminal cervical nucleus. So there's many mechanisms by which somebody can get trigeminal neuralgia. Now, so this just shows where you have cervical nerve 1, cervical nerve 2, cervical nerve 3, cervical nerve 4, that they interact with the trigeminal nerve, even the hypoglossal nerve, which can cause a numb tongue. So if you also have numbness, like you have a weird numbness of your ear, a weird numbness in your face, even a weird numbness of your eye, you know, you touch your eye and then there's just seems like there's a weird numbness, that can be from upper cervical instability. And again, this shows all the interconnectedness. So if you follow the neurology. So I just want to talk a little bit about Hauser law number 2. So Hauser's law number 2 is when a person has a symptom. So say a person has dry eyes, for instance. They have dry eye disease. They can't seem to make tears, or there's a gritty sensation in the cornea and it's driving them nuts. Or you don't even make a good amount of saliva in your mouth, right? So can't make tears or can't make saliva. Hauser's law number 2 is that if you have a chronic symptom and the cause remains elusive, if you follow the neurology will lead to ligamentous joint instability. So again, what's the neurology of the cornea? What's the neurology of making saliva? So you'll see that that neurology leads to the cranial nerves, specifically the trigeminal nerve. So then the trigeminal nerve is in the brainstem, which is right above the upper cervical region. So the cause of it's going to be ligamentous cervical instability. I'm not saying that all sinus pain, ear pain, eye pain is from ligamentous cervical instability. I'm just saying if no one can seem to know the cause, and especially if you or someone with a weird facial, sinus, eye, mouth, ear symptom has other symptoms like clicking, popping, grinding, neck pain, other symptoms, it's likely that it's from ligamentous cervical instability through the neurology that we're showing here. So there's signs and symptoms that I just mentioned and others that show that it's more likely that the symptom is from a neck condition. So if somebody has clicking, popping, grinding, they have neck pain, and the other symptoms that are associated with ligamentous cervical instability, brain fog, cognitive decline, ringing of the ears. We already talked about migraine headaches through the vagus nerve, because again, the vagus nerve is right here. So if the jugular vein is getting compressed, the vagus nerve can get damaged. The vagus nerve innervates everything here. So if somebody, for instance, has a dry eye disease, well, do you also have sluggish bowels? Do you have leaky gut? Do you have excessive bloating? Are you finding that the heart's palpitating excessively, that your heart rate's up? That's called tachycardia. Are you getting dizziness? Do you have ringing of the ears? These are all signs and symptoms. This is interesting what I'm going to say. I've never said this on a video, but when we look at people that come to the Hauser Neck Center, do you know the average person, of the top 15 symptoms that we monitor, real closely, the average person has 10 of them, right? So that's why I think it's very rare that somebody would say to me when they come here, oh, I just have dry eyes, or I just have sinus pain, or I just have ear pain. Almost everybody has a myriad of symptoms, and it's unlikely that the person has 10 different problems. It's much more likely they have one problem, and the one problem is ligamentous cervical instability causing a block of the jugular vein, perhaps injuring the vagus nerve, perhaps causing irritation of the trigeminal nerve. So the way we document the structural problems is with upright cone beam CT scan. We do motion x-ray, which I talked about. And then the pathophysiology, the way we document that is we do motion or dynamic jugular vein studies where we see if there's certain neck positions or head positions that block or compress the jugular veins. We look at eye pressure. We measure the pupil's response to light. So we're looking at the autonomic nervous system to the eye. We're measuring, is there fluid around the eye nerve, because that's the only cranial nerve that you can see really detailed information by ultrasound. And we also measure blood flow into and out of the brain. So with trigeminal nerve problems, especially if somebody has an acute migraine headache, you'll see massive dilation of the arteries on the side of the migraine. It's almost like you could see the and then when we correct the neck structure through cervical curve correction by changing a person's computer height, their sleeping position to make sure the jugular veins are open, and we stabilize the neck by prolotherapy. And prolotherapy is an injection technique that stimulates the repair of painful areas, specifically the ligaments in the posterior part of the neck. So then with motion x-ray scanning, the spine is much more stable. So if we correct the cervical ligament portion of the problem, which often is the underlying problem, and we have a person use good posture with sleeping, with the computer, get the neck muscle strong, normally all the symptomatology, or at least a lot of the symptomatology from trigeminal nerve problems, goes away, and obviously the goal is to get it completely gone.